Hi, good morning everybody, and welcome to this webinar called Volunteering in a Pandemic, Lessons from Volunteering Organisations. So in a moment, I will introduce you to our two speakers, but before I do, I'm just going to explain the format for today's webinar. So we'll present you with about 45 minutes worth of content today, and that'll include 2 polls, and we're going to save up 15 minutes at the end of the webinar for you to ask questions. Feel free to post questions in the questions box throughout because we will be pulling those off so we can summarise those at the end. We won't stop to take questions during the webinar because we've got quite a lot of content to cover, but we will cover as many as we can in the Q&A at the end of the session. So, first of all, introductions. So who's who? So my name, I'm Jo Maycock. I am NCVO's Investing in Volunteers Programme Manager, and I'll be chairing today's webinar. Then we've got Jarina Chowdhury, who's NCVO's Volunteering Development Consultant, and she'll be presenting the webinar today. We've also got a guest speaker, Alison Germain Martin from Royal Liverpool and Broad Green Hospitals. And Alison will talk us through their recovery plans for volunteering. Remember, if you've got any questions, please do add them to the questions box. So by the end of this webinar, we will hopefully understand how local and national efforts have met COVID-19 challenges and opportunities. We'll have explored how volunteering has adapted to the demands of the pandemic, and we'll also consider what needs to inform your recovery plans for volunteering. So we're going to spend about 30 to 40 minutes hearing from Jarina, followed by Alison, and then, like I say, we'll save those sort of 10 to 15 minutes for questions towards the end of the webinar. We'll be closing this webinar today at 11 AM, and I'll now hand over to Jarina to begin her presentation.
Thanks very much, Jo. Today, I want to talk to you about 4 examples of local and national volunteering efforts and how these have interacted together. So in this first section, I'm going to talk you through 4. We're going to look at NHS Responders, Voluntary and Community Sector Emergencies Partnership, Croydon Voluntary Action, and Merton Mutual Aid. So, the NHS Responders is a collaboration between NHS England, Royal Voluntary Service, and the use of a mobile phone app, which you may know as the Good Sam app. So NHS England asked Good Sam to be the registration and deployment platform for NHS volunteers to respond to coronavirus. The service has enabled health professionals, which includes GPs, nurses, NHS 111, ambulance trusts, pharmacists, and even community health trusts, to register a request to help via the Good Sam app. And requests for an NHS volunteer responder are then matched with a volunteer who lives nearby. And Royal Voluntary Service have been responsible for recruiting volunteers initially to support the 1.5 million people, those who were clinically extremely vulnerable, and those who had to shield for themselves for that initial 12-week period because of their underlying health conditions. So I'm just going to give you a little summary then of what's happened and what's been learned to date with NHS Responders. So there was an overwhelming response to this call for help. The original target, you may have seen this in the news, it did make big news. The original target of 250,000 volunteers was met within 24 hours of launching the app. And a few days later, they had over 750,000 sign-ups. So this was actually the largest mobilisation of peacetime volunteers, exceeding even the 2012 Olympics. So there were 4 main volunteering roles. There was a community response volunteer. So those volunteers were responsible for collecting and delivering shopping, medication, and other essential supplies. I think many of you will be very familiar with that role. The second role was a patient transport volunteer. So volunteers were asked to provide transport to patients who were ready for discharge and to ensure that they were settled safely back into their homes. Also NHS Transport Volunteer, so volunteers to transport equipment, supplies and medication between NHS services and sites. And that role also involved assisting pharmacies with medication delivery too, so a lot of behind the scenes stuff. And then a check-in and chat volunteer, so those volunteers that were providing telephone support to individuals who were at risk of loneliness, who were shielding, who were unable for whatever reason, coronavirus related, to leave their home. So quite literally the power was in the hands of those volunteers with that app. I mean, we were told that volunteers could put themselves on duty by simply switching on their app. And I don't know if any of you have seen the app or or if you have the app or if you've had a demo of the app, but apparently a siren goes off when a task is available. So it is quite literally a call to action. So by the time we did the National Volunteering Forum, which was around the middle of June, we were told that over 370,000 tasks had been completed. But on Monday this week, I noticed on social media that 500,000 tasks have now been completed. So it's going strong, and yeah, it's a very, very popular programme. On the other side, I had heard through feedback from volunteer centres and other organisations that people had signed up, you know, all guns a-blazing back in March, but had not been deployed and had kind of gone off the boil. You know, their initial enthusiasm had waned, and you know, then their availability changed, and you know, some people were returning to work or just had less spare time on their hands. So NHS responders have addressed that problem gradually, deploying volunteers according to changing COVID health and community needs. But one of the things that was mentioned at the National Volunteering Forum was that a surplus of volunteers was absolutely necessary for an emergency operation. So although perhaps it wasn't anticipated at the time because everybody was trying to, you know, get this great big programme off the ground, NHS England's data has shown that it takes 3 or 4 asks of different volunteers until a task is accepted. So 98% of tasks are completed within 24 hours, and that is actually down to having a huge surplus of volunteers. So people aren't really sitting around idle. I do believe that they are being deployed, and you know, in the way that they would like as well. So that's really great news. Another thing worth saying before we move on is that NHS England originally commissioned this as a 9-month programme, specifically as a response to coronavirus. But feedback from local areas has meant that the success of the NHS responders has led to a desire to continue. And NHS are now having conversations with different voluntary sector organisations about what that might look like. So it's a good news story, and it's really exciting to be part of that. Okay, now I want to talk to you about the Voluntary and Community Sector Emergencies Partnership. So this partnership aims to help people prepare for, respond to and recover from emergencies so that they can rebuild their lives. Some of you may have heard of this partnership. It was created in 2017 in response to the outpouring of public support. People who wanted to help in Grenfell and the Manchester and London bomb attacks. So there was a lot of well-intentioned but uncoordinated volunteering and donations as well. I'm sure you can remember scenes of donations by people, very generous, but you know, lots of stuff being left outside on streets, and just not having even, you know, having the logistics in place to think about where all of these things could be put. So the Emergencies Partnership is a national platform that gathers intelligence around unmet needs and delivers a coordination role around meeting those needs. And the partnership also has an advocacy and influencing role with government. And I put logos on here to show you the membership of the partnership. It's a range of voluntary organisations. British Red Cross and NAVCA co-chair the partnership. NAVCA is, of course, the membership body for local councils for voluntary service, commonly known as CVSs. And many of those have a volunteer centre integrated into the CVS. And the rest of the membership represents a core group to bring the voluntary sector together in any emergency. They all share the aim of improving coordination at national level and local level. And that goes on before, during and after emergencies. So they will be around and they will be supporting with coronavirus way into, whenever the pandemic ends. We're not through it yet, so they've got a very active role as we go forward. So when all other options have been exhausted, communities can request support from this partnership through their local liaison leads, which would typically be through their CVS. And some of you may have heard of local resilience forums as well. CVSs tend to sit on local resilience forums, and local resilience forums are help to prepare for emergencies at the local level. So the partnership is still young, and COVID has presented a very unique challenge because it doesn't care about geography. Since March, the Emergency Partnership has been meeting and planning their UK-wide response. And this has included setting up the Nightingale hospitals and delivering food and medicine to vulnerable people who need it, providing psychosocial support through volunteers to people over the phone. Volunteers are a crucial part of that, helping to build community resilience. So as I say, the partnership is still young and there is much to learn from its work, particularly around coronavirus. I think is providing a very unique challenge, but does exist to coordinate that national response and to work and support with local resilience forums as well. Okay, so moving on then, I wanted to just share with you something that Karen Chilman, who is the head of volunteering at Croydon Voluntary Action, some things that she spoke to us about. She gave us quite a story actually, and I've tried to kind of summarize it here. There's no way I can capture the detail that Karen gave us. So Croydon Volunteer Centre is part of Croydon Voluntary Action, which is of course a CVS. And I've tried to do a kind of before and now, or sort of before and after comparison here. And I'm going to try and talk you through what that means, what this means. So pre-lockdown, CVA had 2 full-time staff, 3 part-time, and they were delivering very specific volunteering programs, such as supporting people as they come out of custody, supporting young people coming out of supported living, working with mental health issues, also supporting people emerging from substance misuse. So just before COVID came along, they had a main core grant of 70,000, which was reduced to 40,000, and their head of volunteering was preparing to reduce her hours to part-time. No such luck, I'm afraid, didn't happen. And if anything, she's been working, like I think most of us, a job and a half. I'm sure that's something you can all relate to. So Croydon Volunteer Centre had about 120 volunteers registered prior to lockdown. Shortly after the lockdown, they had registered about 600 volunteers. So this happened like lightning. Hundreds of people registered to volunteer. However, local councillors and the local authority also put out calls for volunteers. And when they were overwhelmed, they signposted their surplus volunteers to Croydon Volunteer Centre. So in the first instance, the Volunteer Centre checked suitability for whether new recruits could support vulnerable service users, because what they were trying to do was to support their own designated volunteering programmes and prioritise that first. So they, where that was possible, they recruited volunteers to do that, and they carried out reference checks and DBS checks, ID checks. And then in the first week following lockdown, the Volunteer Centre trained new volunteers to be telephone befrienders and brief them in safe food delivery to those who were shielding. There are at least 19 food banks in Croydon, and food charities and social enterprises would deliver food across the borough according to their understanding of where it was needed. But that didn't necessarily reflect where it was actually needed. So some households were receiving 2 food parcels on the same day. Croydon Voluntary Action played a role in coordinating the food distribution to make it fair and make it equitable and make sure that people weren't going without. Also worth mentioning, Karen said there was a huge number of mutual aid groups. They just sprung up, and Croydon Voluntary Action were very keen to be supportive of them. They really encouraged the neighbour-to-neighbour approach. Mutual aid groups were great at finding very vulnerable people and referring them to Croydon Voluntary Action. That actually led to about 70 to 80 phone calls per day for the first 2 weeks. People asking Croydon Voluntary Action for help, So Croydon Voluntary Action then invited corporates to help them manage the volume of phone calls they were getting from the people who were requesting help. So it's a really great example there of how the Volunteer Centre engaged with companies to help them to kind of add to their capacity so that they could concentrate on other tasks, you know, their small staff team themselves, and how they meaningfully engaged corporates to be useful for this huge recruitment effort. Regular Zoom meetings. Karen talked about having regular Zoom meetings with 160 volunteer befrienders. Nobody would have done this, you know, if somebody had said, imagine doing this, and you know, if somebody had said this 6 months ago, we would all have laughed. Around half the people who'd signed up to volunteer had actually never volunteered before, and they'd signed up via multiple routes. So, for example, they'd signed up through the local authority, they'd joined mutual aid groups, they'd also signed up to NHS Responders. So then those people, you know, they're kind of waiting and kind of, you know, raring to go. And where Croydon Voluntary Action could engage them, they did. They absolutely did. So coronavirus has helped people to discover volunteering, and befriending has been absolutely key. It's been so useful in so many ways for people that want to be befriended and for people who are looking to befriend and to help out. Croydon Voluntary Action are going to continue with their befriending schemes well into their recovery phase until people feel ready and to start going out again. So, mutual aid. So mutual aid groups, they've really flourished. Their response has been truly impressive. They were established with the aim of bringing the community together in the wake of COVID. Before the lockdown had even begun, they were already springing up and organising through WhatsApp and Facebook. You're probably aware there is a COVID Mutual Aid UK website with a map of local groups, some of which operate on a ward-by-ward basis or a street basis. There's no known up-to-date figure of how many mutual aid groups there are in the UK. I tried hunting for this, I couldn't find it. The model is neighbour to neighbour. Groups are self-organising. They're places to offer help and get help. We would describe mutual aid groups as informal volunteering, or perhaps you might call them spontaneous volunteering, so volunteering that takes place outside of an official response. So, just before I talk a bit more about mutual aid groups, I'm going to talk to you specifically about Merton Mutual Aid. I'd like to ask you to take part in a quick poll. So the question, drum roll, we have no drum roll, poll open, there you go. So since the lockdown, have you joined a mutual aid group or a local neighbourhood network? So over to you while you fill in the poll. And while we wait for those results to come in, there's actually a report that came out yesterday from New Local Government Network called Communities versus Coronavirus, the Rise of Mutual Aid. And there's a podcast where two researchers share their findings. We tweeted it yesterday, but definitely worth having a look in there. There are 5 main findings with 5 recommendations. I was listening to the podcast, listening to Howden Helpers in East Riding in Yorkshire, and what inspired them to start their group. They said some really interesting things. I'm assuming that they're a couple, but anyway, they're both being interviewed, and they said that their priority was making sure that people had enough healthy food to eat and their medication to stay healthy. So interesting as well. They had 3 guiding principles: sensible, sustainable, and safe. And they came up with a plan that meant that they wouldn't be asking 200 people to be running around on errands when the government advice back then was to stay home. So that was very astute, listening to them talking about that. And then they kind of moved into, as the situation changed with coronavirus, they sort of moved into helping people more around listening and kind of helping people to stay in good spirits, actually. So it's definitely worth listening to the podcast. I think now I'm supposed to be looking at these poll results. So, okay, so 41% of you said yes, you have, and 59% of you said no. Okay, all right, I shall carry on then. Right, maybe after hearing this presentation, you might be this Merton Mutual Aid, you might be inspired to join one, because they're still very active, and I don't think they'll be going away for some time yet. So there's time, there's plenty of time. Hang on. Okay, so COVID Merton Mutual Aid. So Rahim Hassan Ali, he's a coordinator of Merton Mutual Aid, and Rahim described Merton Mutual Aid as an informal, non-political community volunteer network made up of people that live and work in the borough of Merton, so self-explanatory. He said their Facebook group was set up on the 15th of March 2020, and as of 18th of June, they'd had just under 3,000 members, with nearly half of those people signed up to volunteer. He said that they were in a unique position to act on the ground and respond to community needs in the moment. They started off by identifying people who may have been missed by statutory services and the mainstream voluntary sector. And they were working with existing services and provision by working with the local authority in Merton and also Merton CVS. So they were well networked up to both of those. So they started identifying immediate needs, just such as food, household, sanitary items, medicines. And they realised that people also needed access to reliable, trustworthy information about COVID. And they thought about where they could get this and how they could provide that. They were trying to understand what members were asking for. And by doing that, by that understanding, that helped them to inform their volunteering activities, which you can see here, some examples. And some of their volunteering activities required vetting and checking volunteers. So, for example, those roles that were supporting frontline staff, they managed to place volunteers in 22 GP surgeries across the borough of Merton. And that was an initiative supported by the GP Federation. So they were doing really great stuff down there. And like loads of mutual aid groups, really kind of amazingly imaginative about how they're going to really reach people who perhaps are kind of below the radar. So I'm just going to pick out a few of these. Rahim talked about these in quite a lot of detail, but I'm just going to pick out a few, some of the challenges and the impact that relates to them. So community members, community wasn't trusting volunteers at first, so initially Rahim said that this was a barrier to mobilising volunteer efforts. Mutual aid groups, as we all know, they are unregulated, and that does present challenges. The onus is ultimately on the person who accepts an offer of help. Merton Mutual Aid had to wait a while to get the support from their CVS around training and safeguarding and data protection. They said it did come through and it was valuable, it was much appreciated, but they said they had to wait a while to receive it. So just thinking back to some of the points that Karen Childerman had made about Croydon, we know that local infrastructure has been incredibly overstretched due to coronavirus. So just some thoughts there around, the importance of local infrastructure and how it does need to be supported well in order to support groups like Mutual Aid. Rahim also talked about digital inequality, and he said that some people who really needed help and who still need help have been very limited in how they can access support. So it's not every household has internet, not every household has people with digital skills or people who know how or are confident about using online ways of communicating and accessing help. There were some on the mutual aid group that were unfortunately giving a rather personal and political commentary. This is not the purpose of those groups. It's about practical help for those who need it. It's about giving help. It's about accepting help. It's not about sermonizing or theorizing or, sharing conspiracy theories, which goes back to Rahim's point about reliable, credible information that can be, that can be trusted. So yeah, that kind of misinformation, which doesn't help community well-being, sort of goes against it. So Raheem was very clear with us. He said mutual aid cannot respond to all needs, and this meant as a group they had to recognise when they needed to signpost and refer people to other organisations or services. He said it was their responsibility as a group to offer guidance for their volunteers to do what they felt comfortable with, explaining what roles or tasks needed vetting and what didn't need vetting. So being really clear with people who are volunteering about what would be required. Putting the well-being of the community first in how to keep themselves safe and explaining what a mutual aid volunteer can and cannot do. So they did lots of leafleting and they used the group to kind of share that information around what a mutual aid volunteer can and cannot do. And keeping up their dialogue with the local authority as well, the CVS and other voluntary sector groups, really working alongside them. They held a virtual Merton bake-off, nothing like cakes to get people happy, ways to engage members of the group, just doing fun things to kind of reinvigorate community spirit and boost morale. Especially if there were no volunteering tasks immediately available, you know, just kind of keeping the momentum going of the group, that sense of belonging and purpose. And Raheem really felt that the power of mutual aid groups lies in their ability to lobby change in mainstream services. He said there was a local authority meeting 2 days after they set up, and they were invited to it. So since then, they've been sitting on local authorities volunteer task force group, and feeding into that and giving lots of you know, perspectives from the ground, really kind of real life perspectives, hot issues, heated issues, and making sure that that volunteer task force led by the local authority is very, very well informed. So Raheem's final words to us was, you know, what the local authority may see as working may not really be working. And Merton Mutual Aid were able to point out gaps in services and to say, you know, well, this is how this could be improved. So dialogue from community members and volunteers to influence local services has been a really positive outcome for Merton Mutual Aid. Right, okay, let's move on to how the next section of the webinar, so how volunteering has adapted to the demands of the pandemic. So we're going to look at two main examples in this section. We're going to look at Guide Dogs and Motor Neurone Disease Association. Just to tell you that Guide Dogs has over 17,000 volunteers in over 26,000 roles. And some volunteers carry out multiple roles, and volunteers are supported by over 600 key contacts or volunteer managers. So that's quite a large operation. So on this slide, you can see how Guide Dogs have communicated with their volunteers. They put in place a communications plan right at the start of lockdown, which involved senior leadership right across the volunteer managers, keeping volunteers informed and up to date with government guidance, making sure that everybody was included. Volunteer managers carried out 17,000 keep in touch calls with volunteers. And I'm going to come back to talk about Guide Dogs in a moment. I'm just going to skip over and talk about Motor Neurone Disease Association. I think it's worth saying here that technology has underpinned absolutely everything that's happened in the last few months because we've all been stuck at home. So Matthew Cobble, who's head of volunteering at Motor Neurone Disease Association, he talked to us about how the pandemic had been a powerful driving force for them and given them license and freedom to experiment and to do things quite differently. So previously, Motor Neurone Disease Association had relied on face-to-face selection and interviews. Matthew said they had robust, but in some places inefficient processes. And they'd used what Matthew called a blended approach to training that relied on a 2-day residential training course. So COVID and the lockdown rendered that impossible. And necessity really is the mother of invention. So some of the solutions they came up with then were face-to-face, carried out online, using digital tools. I'm sure everybody's been busy on Microsoft Teams and Zoom, and so were they. Streamlining their recruitment process for some roles that involved, therefore removed the need to even hold an interview. And then deciding to deliver training in short online sessions that were coordinated centrally. So Guide Dogs also, they increased their use of digital platforms and they thought about how that would change their volunteer function and offer. A much greater focus on digital communications, in terms of, up-to-date timings and, being much more cost-effective as well. I mean, that's been a huge driver in all of this as well. How have organisations been able to save money at a time when their income has fallen enormously and probably will continue to fall? So Guide Dogs, just coming back to them again, they developed virtual home checks for prospective volunteers. So they expanded their online learning and development for existing volunteers, making sure that they were being, they weren't left out. They were testing role-specific group training sessions via Zoom. They were engaging with their volunteer voices via Zoom, lots of Zooming going on. And they used social media to thank their volunteers, of course, for Volunteers Week, because Volunteers Week happened in the middle of all of this. I know that's not surprising that people were using social media for Volunteers Week. It is, after all, a social media campaign. But, maybe in a lockdown, when we're all told to stay indoors, social media becomes even more important, and it also becomes a place to connect. Is it a coincidence then that their posts on their Guide Dogs UK Facebook page were viewed nearly 30,000 times by volunteers, specifically for Volunteers Week? So people were looking on social media as a place to kind of congregate and share ideas and kind of be with one another more than ever. Right, okay, so how volunteering is adapted. So just some stats there for you. Tuesday the 21st of April, apparently is National Tea Day. I had no idea about that, but now I do. And Guide Dogs hosted their Great Guide Dogs virtual tea party, which reached nearly 10,000 people. Thousands of people logging on to enjoy a cup of tea with their dog. And now Guide Dogs hold the Guinness World Record title for the world's biggest virtual tea party. So aside from a great PR event with celebrities joining in, Guide Dogs used their online tea party to fundraise by linking micro actions, such as donating the cost of their cup of tea to Guide Dogs. So they've been quite innovative about how they've been kind of managing the coronavirus situation, and they've done some fundraising as well, right in the middle of the pandemic on the 21st of April. So some thoughts for you then. I've done this, and I'm going to just explain why I have done this. So the questions really are sort of, are micro actions and micro volunteering having a breakthrough? That's what I was thinking about when I was hearing these examples at the National Volunteering Forum. So NHS Responders, they also talked about micro volunteering being used for socially distanced tasks. Telephone online befriending has been extremely popular and has been very much appreciated. A lot of health and care charities, like Motor Neurone Disease Association, they traditionally rely on high commitment, high capability, well-established volunteer roles that are mainly face-to-face. However, reviewing those roles and thinking about how those outcomes can be met in a different way, for example, through flexible task-based roles. So is there potential for volunteers to help with micro respite, for example? So on this slide, I'm demonstrating that kind of continuum between informal volunteering and the more formal structured volunteering on the right-hand side. And spontaneous volunteers on the left, on the informal side of that spectrum. We've seen that there's space to play right across here. Micro volunteering appeals to those who don't want to make an ongoing commitment. It's nothing new. We know that many of you have been engaged in micro volunteering for a long time, or you've been trying to think about how to do it. And now the pandemic has kind of given us the opportunity to kind of really experiment. And people who people who don't want to make an ongoing commitment when they volunteer, they don't want to kind of be loyal to one organisation for the rest of their life, as well as organisations that are, on the more formal end, and they're discovering the advantages of micro volunteering. So all of that should be explored, and I think the main kind of learning, one of the main learnings from the National Volunteering Forum is that the pandemic has really pushed all of us to be brave and to be bold and to take bigger risks. It's been a very challenging 4 months, and it will continue to be going forward as well. But it's exciting to see how organisations have really taken the plunge to experiment with new ideas. So, lots to think about there. Now going to move on to recovery plans for volunteering. And we have another poll for you. So, take the second poll. Here comes the question. It's that million-dollar question. Have you risk assessed your volunteer roles? We'll wait for those. We'll wait for those to come in. Wait for the responses to come in. And some of you may be thinking about how to do this, or maybe you're not sure where to begin. Organisations have a duty of care to their staff and to their volunteers and to their visitors. So something that we all have to do, even if it's a bit kind of head scratchy. There are resources on the know-how pages of the NCVO website on risk assessments. I also encourage you to contact your local volunteer centre or CVS. They've produced some impressive materials right at the start of the lockdown. We just began to link to them from the know-how pages, because there's absolutely no point in NCVO producing, trying to produce resources when so many of the CVSs and volunteer centres were just out there producing really outstanding quality materials. I think you'll also be hard pressed to find one risk assessment for volunteers that will meet all your needs. So you'll probably have to use a combination of different resources if you want to be comprehensive about it, and if you want to be confident about the levels of risks that you're going to take in your decision making. Right, poll results. Just bear with me. Okay, brilliant. 84% say yes, 16% say no. That's really good. Majority of you have done this. You're well on the way. Okay, so let's just move on. Okay, so some things to think about when returning to volunteer. We found it helpful to think about 4 groups of people and, you know, where you might want to put your volunteers. Where are your volunteers situated in relation to these categories? So you'll be familiar with these by now. Those who are clinically extremely vulnerable, they will have a pre-existing health condition that perhaps predisposes them to COVID. Extremely vulnerable, top right, those aged over 70, or somebody who's pregnant, or somebody who's pregnant and living with a pre-existing health condition. And it could be that someone who's self-isolating is doing so because they're clinically extremely vulnerable or extremely vulnerable. So you need to dig deep and find out which that is. Or it could be that, you know, if somebody's self-isolating because they just have symptoms and they're not in any of those 2 top groups. So conversations around returning should address a person's individual health and well-being circumstances. No one should be put in a position to come back if they don't want to. Ongoing guidance, you know, offering people ongoing guidance, updating of frequently asked questions to help people deal with concerns and questions, help volunteer managers deal with concerns and questions as well. And also, have you thought about how to help volunteers deal with moral pressure? What you don't want is people to feel that obliged to return if they're not actually in a position to do so. So I'm not sure now. I think Alison is supposed to be coming in shortly. I'm going to have to check with Joe, who's chairing, whether Alison is actually on the line or not. But so when we've been talking to organisations about risk assessments, and we've been hearing about some of the ways in which they've been doing this, the best way that we think, having drawn this from organisations we've been speaking to, is to inquire into 3 aspects. So the volunteer's own health status, look at the volunteer role. What does that volunteer role entail? What do those tasks entail? And also the environment in which the volunteer will be carrying out their role. So this brings me to the end of this section of the webinar. I'm not sure if Alison is with us. I think she had some problems logging on earlier.
Hi, Dorina.
Yeah.
Joe chirping in here. Just to say that, yeah, unfortunately, we couldn't get Alison on to be able to speak. She's been able to join to listen, but we actually can't get her to be able to sort of do her section. So it might be that we'll be able to get a bit of information or a few slides from Alison to send round afterwards, but she's not able to join us. So it's whether you want to carry on with some more around risk assessing, or we can move to questions. So we'll have a little bit longer for questions. So sorry about that, everyone. Technical issues.
That's okay. I'm just wondering whether, oh yeah, because it's a sound issue rather than a slide issue, isn't it, Jo?
Yes, it is. Yeah.
Okay. Well, in that case, I think we probably have to move on to questions, which gives us plenty of time for questions. We've got about 20 minutes for questions.
Okay, brilliant. So we've sort of been taking the questions as we've been going through. So I'll just read through some of them, Dorina, and sort of go through in the same order that they came through. We actually had one submitted in advance of the webinar, which is brilliant. So that one is with specific regard to volunteer centres, how or are volunteer centres, how are they managing their brokerage role during this period? This has taken a bit of a back seat for the person that submitted the question during COVID, due to the fact that the volunteer centre priorities have been more coordinating volunteer response and frontline delivery during COVID. So they're just sort of wondering if that's continued and how people have managed it. But the second part of the question was, how are volunteer centres re-engaging with organisations that they haven't been during lockdown due to that sort of shift of relationship? And also there's been a lack of engagement from many of the volunteer programmes due to the challenges they've been facing themselves, so activity suspended and volunteer managers furloughed, etc. So it's definitely one for the volunteer centres, but wondering if you had any musings on that, Dorina.
I do think it's something that we should probably put out to the volunteer centre Google group to ask them, because it's quite specific to that audience, and there are about 400 people on here, and as I'm aware, the majority of those are not from volunteer centres. So I think it's quite a niche question. I just want to go back to that thing about brokerage. I liked what Karen Chilman had said about in her presentation at the National Volunteering Forum. She actually was quite savvy. She didn't see coronavirus as an extra thing. I mean, of course, it has been we can't ignore that, but she needed to deliver her 5 core programs, and she set those out, you know, working with people overcoming substance misuse, people coming out of custody, young people supported living. So when she was finding lots of people were contacting the volunteer centre to sign up because of coronavirus, because, you know, they had time on their hands or they just wanted to help out. And also when she was being signposted, lots of people from other routes, like the local authority, councillors, local councillors were somehow putting out calls for help, and just other organisations that were overwhelmed with offers of help. She actually took those recruits, and she thought about, you know, playing a classically brokerage role, as volunteer centres do. She thought about matching those volunteers first and foremost to meet the needs of her dedicated volunteering programs. So I think it would be really interesting to kind of explore how organisations have been coping with their brokerage role as well as the demands of the pandemic. And that's probably something that I'd love to explore with volunteer centres in a more kind of in a way to have that conversation with them more directly.
Thanks, Dorina. Hopefully for anybody from volunteer centres that answers some of your questions there, but there's definitely more that we want to pick up with them via the Google group that we have. Yeah. So we've got some sort of questions that came in that I think we actually reflected a little bit on during the presentation, but a comment about the NHS Responders call up and how great it was. But unfortunately that many of friends that people have heard of who had signed up but actually found that they were never used, and they found that quite frustrating. And the question was, had there been any analysis done of why so many people signed up to the NHS Responders? And also if it was something that would continue afterwards as a more long-term thing, as it did pop up during COVID. And I know that you reflected on that before, Doreen, saying that this has been actually working really well, that there's now a bit of a partnership looking at how they can carry that on. But just wondered if there was anything to add there.
Well, that is a joyful question, whoever asked that question. And the reason I say that is because I don't know if there's been any analysis done of why so many people signed up to NHS Responders. I do know that NHS Responders are running a survey this month to their volunteers, and those findings I think will be fascinating and provide enormous lessons for how other types of organisations of that scale, other types of volunteering programmes of that scale can learn from. So I'm looking forward to inviting somebody from NHS Responders to come and to share those findings. I will be organising that. I can't remember the rest of the question, Jo, because I've got too excited. Can you say the second part of that question again?
The second part was about the fact that this has obviously, you know, mobilised quite a lot of people in the response to COVID. And was there going to be any of this carrying on long term? So for more volunteers long term in this way?
I think there probably are plans to do that. Surely they will also be informed by the findings from the volunteer survey that the NHS Responders are going to carry out this month. There are definitely plans to do that. When Emma Easton, who came from NHS England, NHS Improvement, came to speak at the National Volunteering Forum, she said that they'd been very excited by how successful the programme had been. And it was supposed to be for a specific period of time, 9 months, I think she said. But there are plans to carry on, and she did say that back in a month ago on the 18th of June. So that's encouraging. And yeah, I think we'll have to kind of watch that space, really.
Thanks, Sharina. We've got a question here that was around the Emergencies Partnership. So does the Emergencies Partnership link in with the voluntary sector work that happens in normal times? For example, so people can be referred, signposted correctly where they would benefit from it in normal times?
The Emergencies Partnership is there to help with national emergencies. So, for example, if you remember the floods, that was another good example. You know, the kind of floods that have been blighting us on and off for the last sort of 10 years. The attacks, Manchester and London bomb attacks, and of course Grenfell. The partnership is still quite young. I feel like they've got a lot of learning to do among themselves, and also how they relate to the kind of more local infrastructure. But I mean, as far as I'm aware, they exist for emergencies. That's why they came together. So no, they're not there to, unless we're permanently living in an emergency, which I hope not, then they shouldn't be needed. You know, that kind of level of mobilisation shouldn't be needed. So yeah, I hope that answers the question.
Thank you. I'll just say again, we've got quite a lot of questions sort of coming in now. We'll try and answer as many as we can, but if we don't get to all of them, you know, we will be submitting sort of resources and links to know-how in our sort of when we send around things afterwards. So you should be able to pick up some answers then. Also, you can email the volunteer development team and we can pick up things with you then as well. Somebody had asked if we could post the link to the Communities versus Coronavirus and the Rise of Mutual Aid. So we've got that link and we can pop that in the chat, and we'll also send that round afterwards. Moving on to some more questions. So some relating to risk assessing of volunteers. So somebody's asked, most of our volunteers are in risk categories sort of over 65 with health issues, and our services require them to attend the site. They will be understandably fearful and reluctant to return, Without the volunteers, we can't open and operate. So is there any advice? I know that's quite a sort of big ask of you, Dorina, there, but just then, if there's any sort of guidance of what we've heard from other organisations that might be useful.
Yeah, I think just keeping the, sitting down and doing that. I mean, I would also say that you need to have a phone conversation at the very least. I don't think you can do, I know it's an enormous undertaking if you've got lots of volunteers, and even the intensity of the conversations. I know that they will be quite exhausting. So you actually need to think about, one person can't have all of these conversations. Even if you've only got 15 volunteers, that's quite a lot for one person to be sitting down and having these kinds of kind of emotionally exhausting conversations, really. So I'd think about how you set up having those conversations, having people who are sensitive and know what to ask to have those conversations. But having things like frequently asked questions updated on a weekly basis and making that available to everybody, that you can do by email after you've done your initial risk assessments, and looking again at people's specific health circumstances and how they're feeling emotionally as well. I mean, I understand that people being fearful about going back. I completely understand that, and I think that is probably where most people need to kind of focus their efforts, in terms of how people are feeling. If their fears are unfounded or well-founded, it doesn't matter. It matters that they feel able to return. And we have put some, I put some risk assessments in, Joe, at the end. They're quite a broad mix. The only one that's specific to volunteering, well, there are two. There's Sport England, which is return to play. I appreciate not everyone is involved in sports volunteering or running clubs. There's one also, Canal and River Trust, which is more kind of outdoor volunteering. And then there are some other things that are drawn quite specifically from sort of health and social care, because I think that they are a bit further along the line than sort of typical voluntary sector organisations, unless the voluntary sector organisation is health and social care itself. So, as I said, I don't think you can find one document where you're going to be able to find all the answers. You're going to have to beg, borrow and steal from different resources, but I've put about 5 or 6 resources on the slides with hyperlinks, so people can have a look and pick and choose the bits that will best help them have those conversations.
Yeah, we have got a few questions sort of asking about that risk assessment side of things and specific activities, and whether the volunteer themselves can kind of risk assess, or if they need to align with the risk assessment that's been done by the organisation. So I think referring to all those different resources should help with those questions.
Yeah. I mean, you do. I would say that you do have, the organisation has to risk assess. This should be a guided conversation. Even if it's filling in a form, the person should be asking, having a guided conversation. The person who's leading the volunteers should be asking those questions. I don't think that people there may be some aspect of it where people can do a little bit of like filling in some questions about themselves and then sending it to their volunteer leader, but then their volunteer leader will need to check that back with them. You shouldn't just assume that what they've written down on that day. I mean, what if it takes you 3 weeks to get back to somebody because, I don't know, organisations are so sort of under capacity at the moment, and their situation may have changed drastically in 3 weeks. So I just think constant checking back with people and letting them tell you as well, letting them tell you if their situations have changed. If last week they said they felt fine, but actually this week they don't want to come anymore and they don't know how long that's going to go on for, just accepting that and, being up to date with conversations with them around how they're feeling.
Thanks, Dorina. I've got a question here that says, in East Riding, we encourage voluntary groups to share volunteers, and wondered if there was any wider examples or learning available to help develop this further.
I'd love to know more about how you're doing that. When you say you share volunteers, do they know that they're being shared? I mean, because lots of people volunteer, in multiple places, but they just, you know, the volunteer themselves, they know that they're sharing their time. But I'm just wondering, from the organisation's point of view, is this something that's pre-arranged? Is this an arrangement between, you know, a recognised arrangement between partner organisations? So I'd like to know a bit more about that. I don't know, maybe we can follow up with that person, Joe. That sounds like an interesting example. Maybe that person would like to write a blog for NCVO about that, or come and be a speaker on a future webinar about how that's working.
Yeah, that'd be great if they could like email us with their details, and then we can follow up with that afterwards. And Rob has probably got a note of who sent that in as well for us. We've got about 4 minutes left, so I'm probably just going to give you one more question, Jarina, and then we will wrap up so we make sure that we end on time today. Will there be any work done on the impact of negative experiences of volunteering during COVID-19, especially those that offered to volunteer either through national or local apps, and also for local groups and mutual aid and when needed, or volunteered but didn't have a great experience? Again, I think that kind of links back to the sort of looking at the analysis earlier from the larger response. But Jarina, do you know of anything else that's going on? I expect lots of people will be reviewing their COVID response and learning from those lessons.
Yeah, I mean, there is a COVID-19 evidence gathering group that has been gathering evidence relating to volunteering ever since the lockdown, and that's made up of the NCVO research team are involved in that, the Voluntary Sector Studies Network, Third Sector Research Centre, always worry that I'm going to say that wrong, Third Sector Research Centre, and also the Institute for Volunteering Research, which is based at the University of East Anglia. So I'm actually going to take that point to Head of Research at NCVO, because I think that's really interesting, impact of negative volunteering during COVID. I will take that back to her. Thank you.
And we have actually got lots of questions that have sort of asked about that, and I think that's something that we should be looking into and linking in with as well. So that sounds like a great idea. Just a quick note before we wrap up that I've actually had a comment from Emma from NHS England when you were talking about the longer term plans for volunteer responders. And she said, in short, yes, there are plans to continue NHS volunteer responders longer term, both at national level to support national NHS initiatives, but we're also looking to integrate with local infrastructure to meet local needs and complement what is already happening out there. And I think that's really important. And in the interim, we're also considering how we respond to a second wave or future local and regional lockdowns as well. So it's good to just sort of tie that up with Emma coming back to us there as well.
Right, thanks, Emma.
Yeah, great. So thank you, everybody, for joining today. I hope the information has been useful to you. Like I said, there's been lots of questions, so unfortunately we haven't been able to answer them all in this session. But please do refer to the resources that are available that we'll send round. There's lots of blogs with lots of different resources embedded there as well. And we will take those thoughts and questions back with us so we can actually think about what we might be able to look into to share further with you in the future as well, about looking into things further. So thank you very much, and thank you, Jarina, today. And I'm sorry that we didn't have Alison to join us. We will see if we can send something round on her behalf as also. Thank you.
Thank you.